Hello and welcome to another episode of Health Afrik, and this program is brought to you by the Association of African Universities. On this program, we discuss health-related issues, and not just that, we also bring to you solutions to address them. And today, we are privileged to have here with us an innovator who is here to connect with Ghanaians' healthcare system to create real solutions to address sickle cell. We all know how this disease continues to affect families, especially how it gets worsened when there is late diagnosis. My name is Isabella and I know you wouldn't want to miss this discussion. Stay tuned, we'll be right back.
African University's television, AUTV. I just want to say that without the media, you won't know what's going on in the world. Even with the media, you sometimes don't know what's going on in the world. So you need to tune in to the reliable sources who are really on the front lines, who can give you the information you need and give you facts, not conjecture, give you real news, not fake news. And this is the place to find it, AUTV.
The voice of higher education in Africa.
You're welcome back from the break, and if you just joined, this is Health Afrik, and you can follow the discussions on our social media handles at Association of African Universities, both on Facebook and YouTube. Like I made mention before the break, today we have here with us an innovator who, through the SIAD project, specifically the Soft Landing Program, came to Ghana to pilot an AI-powered tool to solve or to help clinicians diagnose sickle cell way faster, way earlier, and also to give precise, data. And we have here with us Miss Auindrila Das, who is the CEO of Gclinics, and she's here to share with us her innovation. Hello, Das. You're welcome to Health Afrik.
Thank you so much.
Right. Today we are here to talk about an AI-powered tool which is going to help Ghanaians, especially clinicians, to diagnose sickle cell faster and earlier. Before that, briefly tell us more about yourself.
Sure. So my name is Auindrila Das. I'm based in Ireland, but I'm originally Indian. I moved to Ireland for my master's and then kind of settled there now.
Okay.
I am the co-founder and CEO of Gclinics, where we are enabling clinicians to be able to diagnose and manage genetic conditions better.
Okay.
I'm a genetic engineer, so my primary degree was in genetic engineering, and then I did molecular medicine. Pretty much the first part of my educational journey was research focused, so it was oncology or rare diseases, but then I kind of transitioned into industry, and I worked for a lot of ambitious European startups, but also multinational diagnostic companies like Abbott and Pfizer. And I suppose while I was working in these organizations and my previous experience of working in genetics and healthcare, I identified this gap that pretty much precision medicine is very much expert-led, and we don't really have great tools to be able to leverage that knowledge and translate into healthcare. So that's how I founded Gclinics.
Okay. Right. I think you briefly tell us the vision behind Gclinics, but as a CEO, what is the ambition? What actually enlightened you to come up with Gclinics?
I think the vision for Gclinics is to make advanced genetic diagnostics accessible for healthcare professionals everywhere. We believe that molecular diagnostics or genetic testing and the information that it brings shouldn't be stuck in specialist labs or in tertiary care. It should be really in the hands of clinicians who are making day-to-day healthcare decisions. So that's why we developed this platform, which is called GeNova, which brings this power of molecular diagnostics and genomics in the hands of frontline clinicians, so that with this kind of diagnostic intelligence, they'll be able to identify early signs of conditions like sickle cell and really be able to bring precision medicine into primary healthcare.
Okay, you made mention GeNova, and also you are saying it's an AI-powered tool. Now, how is this going to support clinicians? Like when it comes to practically, how is it going to support them to make these diagnoses faster and earlier?
Right. So GeNova was simply born out of a very urgent need for a tool which can simulate the role of a genetic expert. It was important, I believe, when I was working with a lot of diagnostic companies and I kind of came across a lot of clinicians who were really struggling because there was a huge dependency on human experts.
Yeah.
They're so few in number. Only 8,000 genetic counselors exist in this world.
Worldwide.
Yeah, so you can imagine the numbers don't add up. So I suppose we were thinking that in the era of AI, like first of all, it's important to incorporate it into clinical workflows and understand the impact of it. But how can that really help in scalability of knowledge? How can it really bring the expertise to clinicians, healthcare professionals worldwide? So the tool is an AI native platform. What it really does is it acts like a companion for a clinician. So it's like having a genetic expert in a clinician's pocket. So they can ask questions regarding a diagnosis. They'll get a lot of differentials, like, what are the probabilities of this particular patient having sickle cell or thalassemia or any other hemoglobinopathies. And then also identify the right test for the patient. Genetic test, even though the prices are kind of coming down now, but they're plummeting, but still it's a much more expensive test compared to a normal routine blood test, right? And it is very complex as well, because genetic tests can reveal so much about your health, about who you are, and a lot of times the patients are not ready for it. So in that case, identification of the right test is important. Also, just to kind of add a few numbers here, like right now we have more than 120,000 types of genetic tests existing. A lot of them are used for clinical research purpose, but the number is 120,000. So if you ask any clinician, they really don't know which one is the most appropriate one. They're probably using some of the test which has been used for the past 10 years, but there are way more advanced tests which can really tell you maybe if you're having pregnancy loss, is there a genetic causality for it? Is it a male factor which is causing it? So it's important to identify the right test. So the system, GeNova, will help the clinician in also identifying the test selection piece. Once the test happens, then the result comes back to GeNova. And you can imagine if it's a genetic test, it's very complicated. You have primary findings, secondary findings, and that huge amount of information, clinicians don't really have time to kind of understand that, navigate it, and bring that information back into the healthcare plans. So usually a human genetic expert would do that. But our system has an intelligent way of summarizing and simplifying these complex test results into a clinician-friendly report. We also have, the system also has a functionality to make it patient-friendly as well. So it can generate two types of reports. One, which is specific to the clinician, and it kind of makes sense in terms of the care planning. And then one for the patient, really communicating in a very simple way that what it means, what the test was all about, and what are the next steps. So you can see how it really works hand in hand. And then, of course, the care plans which comes after that is extremely important. So when I say care plan, I don't mean treatment. What it really means is, does the patient needs to be referred to a different specialist? Maybe they need to see a hematologist or a gynecologist. Do they need to see a genetic counselor? So Gclinics has its own network of genetic experts who are globally based, which is something that we have been building for the past few years. So how it will help a normal clinician is they can tap into that expertise as well. Not just the softwares, but also the human expertise. So it really brings a lot of value in the entire value chain.
All right. Indeed, we are seeing the benefits of artificial intelligence. I mean, this would have been done within a longer period, but with the help of AI, I mean, within just a period of time, you can get your data as soon as possible. Thank you so much. This is being piloted in Ghana, and you know, before something will be accepted, especially a new initiative, people need to understand or know the value. You've explained so much the benefit and the value to that will be added to clinicians, but let's look at the hospital as a whole as well as policymakers. What value is this initiative going to add to them?
So I think, yeah, of course, as I just mentioned, for the clinician, it's more confidently, like, you know, diagnosing patients. But maybe for a hospital, then I think the trend that we see is there is a huge number of hospitalization. The costs are increasing day by day. So if we can proactively manage it, this is going to get reduced. It's going to bring a lot of efficiency because GeNova gets embedded into existing clinical workflows. So it's not that there is another system that the clinician needs to get into. It gets plugged into their existing workflows and it's extremely seamless. So for a healthcare system like a hospital or a clinic, it's going to be extremely easy to adopt it and bring it to their clinicians. And it will increase their efficiency, cut cost, and, like, you know, reduce a lot of patient-related expenditures, which comes along if the right diagnosis doesn't happen. So, and for policymakers, I think we are kind of thinking about it, of course, at a national level, like, you know, how can we use patient data, of course, with their consent, to bring more proactive healthcare policies. Like one of them is already running in Ghana, the Human Genome Project, the Ghanaian Genome Project. So with that kind of information, you can really build more innovative tools so that, you know, you can take the next step in healthcare. So I suppose it's going to help them at all levels. Yeah.
Right. You seem to be very knowledgeable and so much interested in Ghana. So someone watching us will be like, okay, so why did you choose Ghana to pilot your innovation? Well, what is the story behind your interest?
Right. As I mentioned earlier that I originally am Indian. So when in the early years when I was only like studying about genetics and like was doing my genetic engineering, I feel I did get exposed to a lot of rural places of India, and I used to go there for my projects, like you know the mid-sem projects, and I would really look at a lot of autosomal recessive conditions, and one of them is sickle cell. So when I was studying, I already knew the demographics and the countries which are already impacted by it. So Ghana would have come up a lot of times, like Ghana or Nigeria, like, you know, they're really impacted by sickle cell. So I suppose the fascination kind of came from that point when I was working back in India. The condition was same, like I was still working on thalassemia and sickle cell. So I already had an idea of what parts of the world are really affected by this condition. But also, I suppose, when I was thinking about the strategy in terms of how I'm going to roll out Gclinics and GeNova, there were few countries or few regions which came to my mind where the need is. Let me put it this way. Like, of course, I am building it in Ireland, and like, you know, it's already launched there, and like a lot of Irish clinics are using it right now. But the goal is, or the vision for Gclinics is to become a global product, because even though the expertise is accumulated in one part of the world, but the conditions or the problem exists everywhere. So I thought that why don't I build it for a larger population? And Ghana is something which kind of came out of serendipity, because I think I was looking for programs. I was looking for a way to get into the African ecosystem. And one of my friends back in Ireland told that they have applied for the CED program, and it was just literally on the day, like, you know, the day when the application's deadline was, like, you know, literally coming to an end. I just applied for it, and I thought I might not get it. It's okay, I'll just go for it. But I got selected, and it was for the Ghana program, and I'm here in next 2 months. I just booked my ticket and I'm in Ghana.
Wow. Thanks to the CED project for, bringing actors or innovators to the ecosystem to introduce their innovations. You mentioned talking about SIAD, so we would want to know how, I mean, now you are in Ghana all the way from Ireland, how has the program actually supported you, introducing you to the main actors you're looking for or the ecosystem? Yeah.
Oh, yeah, I have to say immensely. I
Okay.
mean, from day one. The first time we obviously had an online meet and greet, and kind of it really helped me understand that there are operators in the system who can guide me, because obviously coming all alone like to the system would have been maybe a little bit difficult for me to make those connections. But I have to say that the mentors and the program coordinators have a solid network in Ghana. So when I told them, I was very kind of open about what I really wanted to achieve, like where am I, what I'm doing, and what I want to do. When this clarity was given to them, they immediately got on to kind of getting meaningful connections. They're like, who can you talk to? Like, and that didn't even like, they didn't even know that I was going to make it to Ghana in next 2 months. They were kind of organizing even online meetings. But of course, I expressed my interest that I want to be in the market where I'm building the product. So then I think a lot more connections came together, and that spanned from healthcare professionals, research institutes, even like innovators, like health tech companies. So I have to say I've been getting like immensely supported from day one from the program, and I'd say that they are like doing a really good job. Like I have to say that.
Okay, thank you so much. The conversation is getting much interesting now. We'll go for a break. When we come back, we'll dive into the stakeholders as well as look at some of the challenges you may face. Stay with us. We'll go for a quick break.
Explore a whole new world of exciting visuals with AAU TV. Get ready for a mix of interesting talk shows, interviews, discovery documentaries, and news on AAU TV. It's not just about watching TV, it's about experiencing something special. AAU TV reaches over 25 countries in Africa, bringing you a blend of knowledge and fun. Learn about different cultures as you enjoy the shows. If you have events or want to showcase your business, we've got you covered. Watch AAU TV free-to-air channel on satellite. Connect with us on Facebook, Instagram, and X, formerly known as Twitter, at AAU TV. Reach out on call or WhatsApp us at +233 26 629 6601 or +233 20 399 5210. AAU TV, the voice of higher education in Africa.
Welcome back from the break, and this is Health Afrik. And on today's episode, we are discussing or talking about GeNova, an AI-powered tool that is here to support Ghanaians, clinicians to make or diagnose sickle cell way faster and earlier, and also make it precise. And we are here with us, Auindrila all the way from Ireland, who is the CEO of Gclinics. Hello, Das.
Hi.
Thank you for sticking with us.
Yeah, of course.
Before the break, you made mention what you've benefited from the SIAD program and also how you engaged them, and they introduced you to some actors, researchers, health tech and all that in Ghana. I want to know, or would want to know, who are the stakeholders, the key stakeholders you are looking forward to partner in Ghana, since you are piloting it in Ghana.
Right.
Who are the stakeholders you are looking forward to partner with?
Okay, so in terms of what we are looking for in the next 2 quarters, we really want to talk to a lot of kind of healthcare institutes, so like clinics, hospitals, and they don't have to be always at a tertiary level. They can be private clinics and hospitals, but who are actively looking at patients, like pediatricians or OBGYN, who are looking at patients at a risk of sickle cell. And then we also want to talk to a lot of labs, like, labs who are like, in the molecular diagnostic space, but also like, labs in general, because I believe the solution is obviously going to solve the genetic testing problem, but it also has a potential of other tests. And then we also are already actively engaging with Ghanaian startups who are in the health tech space, because we believe that we can leverage that like that infrastructure that they have already laid out and like make use of it. And of course, like with Ministry of Health, like we do see this scaling in near future at a national level. That's the ambition. So we do want to kind of talk to like Ministry of Health, Ghana Medical associations, to see this forward.
Okay, so with all these stakeholders mentioned, what role do you envision they can play to make this successful in terms of adapting the role, the tool in Ghana?
Yeah, I mean, all the stakeholders that I've told, like they all each have a function. So of course, clinicians are our end users. So like clinics and hospitals would want to offer this to their clinicians so that they, of course, bring efficiency, but also they make their clinicians' lives easier and they diagnose patients correctly. For labs, they are the ones who are offering the tests. So in that case, obviously, like, they want a IT infrastructure to be able to bring that into clinical, translated into clinical care. And then I think the digital health, ecosystem, they really would see this as an added advantage. Like, we are playing in a very niche area. We don't really have a lot of competitors. There are a few in America, but I mean, for the rest of the world, like I feel we are really bringing something incredibly niche and next gen. So in that case, I think it's going to elevate their current platform and offer more to their customers. So and for Ministry of Health, I think proactively they're managing like, sickle cell and various different conditions, like even cervical cancer. So we are starting with sickle cell and reproductive health, but we will get into oncology. We are going to get into cardiovascular and like rare diseases. So from a government perspective, it's going to go into all areas which will matter in the next 5 years. So yeah.
Great. We're looking forward to this. When we talk about AI, there are lots of issues around, especially data, privacy, and then ethical issues. How is your innovation going to address all these?
So privacy is non-negotiable for us. I think I did not mention one thing, but I have a strong background in compliance. So like when I was working for the diagnostics business, I was head of regulatory affairs for Abbott for like a few years. So for me, compliance comes first. In terms of how GeNova is designed, it's going to be using a lot more anonymized patient data wherever it's possible. And also, ultimately, the control of the data really stays in the hands of the patients. Without explicit consent, nothing happens with it. So obviously that, and also like the way it's designed, like we are operating in Europe, we are going to be operating in Africa. So we are already compliant to a lot of international standards like GDPR and HIPAA. So I suppose taking into consideration the local requirements for data privacy, I think we'll be in a good position to be able to pilot it with all the standards.
Okay, great. I know it is not easy, especially when it is new, for people to just accept it and start using it. I mean, you coming to Ghana, you've met some of the stakeholders and you are looking forward to partner with. Share with us some of the challenges, I mean, you have faced and will be facing in your journey of introducing the innovation in Ghana.
So, yes, you're absolutely right. We are in a very different category, and when you are almost at a category builder stage, like there is a lot of apprehension around what is the fate of this, and we have quite a few in it. So we have genomics, we also have AI, and we are operating in a healthcare ecosystem. So I feel the most important thing that we realized is the safety. So whatever information GeNova is giving to a clinician, what is the risk and safety around it? And we built it in a way that, it always takes that into consideration. But also at the same point of time, developing trust with the healthcare professionals who are going to be using it is key in this whole process. So in order to do that, I think my approach is to build with them rather than building the product in isolation and bringing it to them and saying that, okay, this is how it works. The most important thing is to have an iterative process and bringing the clinicians in the process of development so that like their active feedbacks can actually help us iteratively improve the product.
Exactly.
So this increases the trust, this kind of brings a lot of credibility, and I think kind of one of the biggest challenge kind of is tackled in that way, but also affordability is a very important thing. But the way we look at it is we are going to really make a lot of improvements in affordability rather than costing more. So, yeah.
Okay. And what does success looks to you in terms of long term and short term? You will soon be going back to Ireland. So what do you envision as a success to you?
Right. So first thing first, I'm back in Ghana in 2 months. So that kind of I think tells you that yes, I'm here for the longer game. But in short term, I think what we see is like, GeNova really being used by clinicians in the sickle cell situation. So like, for sickle cell patients and diagnosis of sickle cell. In future, the long-term goal is to delve into the other medical specialties like oncology and like rare diseases and really bring it at a national level, but also at a I would say sub-Saharan level where more countries in Africa can use it. So yeah, that's kind of like what the long-term vision is.
Okay. Thank you so much, Auindrila. Thank you so much for having us here and for coming and also sharing your innovation with us. I should have asked you, this is your first time in Ghana, right?
It is.
You're welcome. You're so much welcome. In fact,
Thank
we would
you so
love
much.
to have you here all the time. And going back, you're welcome the second time. And we hope
Absolutely.
the success of your innovation. But before we go, wrap up, what will be your final words to the stakeholders, clinicians, healthcare, hospitals, and policymakers? What is your final words to them? They may be interested, in collaborating with you.
Sure. I'd just say simply, let's build it together. Innovation doesn't necessarily happen in next-gen labs or high-tech buildings. I think it's deeply rooted in the local expertise and the adoption of a new technology and the approach towards it. So I do believe that if we build it together, you're going to be a part of it right from the beginning. And we can call it an innovation which is developed with the community, with the clinicians, with the stakeholders. So my message would be if you really see that genetics or genetic diagnostics becomes a part of your everyday healthcare, please drop me a message on my email address is on my website, and I'd be very happy to kind of meet you when I'm in Ghana or even take a Zoom call.
All right. Thank you so much, Auindrila. Thank you for coming. And again, we are hoping for the success of GeNova in Ghana.
Thank you so much.
And this brings us to the end of today's episode where we discuss an AI-powered tool that is going to support clinicians with sickle cell diagnosis. As mentioned, this is being piloted in Ghana, and we need you all on board to give the feedback so that it will be updated to really meet our needs. My name is Isabella and hope to see you again in our next episode. Bye.